So what are these other non-medication type of things that you can do for your loved one or yourself at end of life to help with these symptoms that pop up and that are very common at end of life? In my first video, I really addressed three things that you can do, particularly around having difficulty breathing at end of life. And today I'm going to talk about another one in part of these series. Hi, my name is Abigail. Here to normalize these conversations and education about death and dying so we die better at end of life. Let's get into it today. A really interesting, and I think something that doesn't feel so common at end of life symptom that happens is bleeding, or what we call sometimes in the medical community is bleeding out. And you may not think, well, I don't really get it. Why would my loved one or I be bleeding out? Well, this is usually reference to things like having tumors that are around major blood vessels, or even just any kind of blood supply. So usually these, tumors or cancers that are usually like in the throat or neck area, any type part of the face, there's a lot of blood and vasculature there, just a lot of blood vessels there, or even like a wound, a wound that's pretty severe, pretty big, any place that has a lot of, issues with, blood flow, certain breast cancer lesions or from treatments and things, you can have those as well. So again, you can always refer to your medical team any questions about this. In my medical experience, I usually saw this with cancers that were of the tongue, again, a part of the face, the neck, where I would see issues with bleeding out. Also, sometimes in the genitourinary, so meaning kind of bladder, reproductive organ, especially with biological women that had a uterus, and they had some severe issues with that, and some cancer and stuff, related to those types of body parts. So sometimes they would just have a lot of bleeding. And really, this is more for the loved ones, the caregivers of the family, the loved ones that are at the bedside of the person who's dying. And that was black linens and black towels. I would actually, even as a director, I would carry big black towels in my car 24/7 because sometimes every once in a while, I did have a staff that would call me and say, you know what, I need some black linens or black towels. I usually have like the black beach towels that I got at Walmart or Target for a patient who was starting to bleed. And it really, what it's there for is to just create less of a shock, because when you start to see blood, especially on lighter sheets, it just, it looks almost like a lot more than what it is. Maybe it might be coming out. And it can be very, very hard to see. It can be quite traumatic, and we don't want to add to the trauma of the experience for the loved one. Depending on, say you have a loved one who's dying of, an end-stage cancer, and the medical team told you that there is a risk of some bleeding. Hopefully your hospice team that's working with you is telling you what to expect to. And if this is the case, then this is where you'd say, okay, so when would we expect the bleeding, and how much? And then it'll be a good time to get some dark linens or dark towels. And you can use anything that's kind of navy blue-ish, and black is ideal, but if you have like a dark navy blue, that's really helpful. That really does help kind of mask the color. And it's just good to have these on hand, because if and when the person who is dying starts to bleed out, it's going to be inevitable that they're going to bleed. Doesn't mean you're not going to do nothing about it. You can you obviously call your hospice team and get them on the line and see what they recommend. They may be putting some kind of certain special dressings on there, but again, bleeding that is really related, that any kind of issue that's really invasive and really kind of, like a tumor that's really growing into certain big vessels in the neck, for example, can cause a significant amount of bleeding. So, and you're not going to always be able to stop it. At the end of life, we're allowing things to happen naturally. So what we're trying to do is minimize the kind of traumatic effect that it may have for the loved ones surrounding the person that is dying. So having these types of dark, ideally black linens, if best is if they're towels, because they're a little more absorption, have a little more absorption. And then underneath you can put either like a plastic bag right under that, so it doesn't really hopefully absorb into like the mattress and stuff, or another different type of protection. It can be very helpful. And having more than one obviously available is really important, because once the bleeding starts at end of life, it may continue for a bit of time. It could happen for hours or until the person dies. So This is really an important thing, like when you discuss and preparing for end of life and the symptoms that you may see for yourself or your loved one, and communicating it with your loved ones so that they understand what we're doing and why we're doing it. And also you have to involve your hospice team and medical team in every step of the way, because you need to do this under their guidance, okay? These are just things that I learned in the field that I also applied as a clinician and director. But again, you must always work with the guidance of your hospice team and medical team. Let me know if you have any questions. Again, I'll do another couple more of these on the kind of the non-medication type of stuff that you can do even as a loved one for the person who is dying at the bedside. My name is Abigail, here to normalize these conversations and education about death and dying so we die better end of life. I'll talk to you soon.